Is AI already killing us? No, I'm not talking about killer Terminator robots, but stay with me. Because right now, major insurance companies are using artificial intelligence to decide whether you get the medical care your doctor says you need. And in case after case, patients are being denied. Some of them never make it out alive. Yeah, that's real. And it's happening to everyday people like you, and that's just the beginning. This isn't just a story about health insurance, it's about power, profits, and invisible death sentences handed out by algorithms. Behind closed doors, health insurers like UnitedHealthcare, Cigna, and Humana are deploying automated systems, some AI, some algorithmic rule engines, to rapidly deny thousands of claims per day. One of the most notorious systems? A Cigna tool known as PXDX, which let doctors deny claims in just 1.2 seconds, without ever reviewing patient files. According to a 2023 investigation, Cigna doctors denied over 300,000 claims in a 2-month period, each in less time than it takes to blink. But that's not even the craziest part. Insurance companies don't make money by paying claims, they make money by denying them. A recent study found that nearly 1 in 5 in-network insurance claims were denied in 2023. For out-of-network care, that jumped to over 37%, and most people never appeal. Why? Because the system is designed to wear you down. Endless paperwork, automated phone loops, delays that drag on for weeks or months. Americans spend at least 12 million hours a week calling their health insurance company, according to a Gallup poll. Meanwhile, the AI that denied your CT scan, it doesn't get tired, it doesn't get sued, and it just saved your insurer thousands of dollars. This isn't theoretical. There are real people with names, families, futures who have died waiting for care, like Nataline Sarkisyan, a 17-year-old who needed a liver transplant. Her doctors at UCLA approved it, but Cigna denied coverage, saying it was experimental. After protests and national news coverage, Cigna reversed its decision. But it was too late. Nataline died hours later. Or the unnamed teen boy who overdosed after UnitedHealthcare refused to cover his residential addiction treatment. His parents say the denial was the direct cause of his death. They're now suing the company. Or the countless Medicare Advantage seniors whose post-acute care is denied by automated tools like NH-Predict, built to determine who deserves care and who doesn't. Some die alone in nursing homes, others never recover. And then there's the devastating case of Tracy Pike. Tracy, a 45-year-old father of 3, was diagnosed with stage 4 stomach cancer. His doctors recommended surgery and chemo at MD Anderson Cancer Center, standard practice supported by leading physicians. But Blue Cross Blue Shield of Illinois refused to pay, labeling the treatment experimental and not medically necessary, despite MD Anderson's backing and national cancer guidelines. By the time a reversal came too late, Tracy had already passed away. His wife, Angela, later learned the insurer relied on a non-cancer specialist to veto the decision. The insurer's denial didn't just delay care, it cost a life. These tools aren't science fiction. They're standard practice. In 2022, over 90% of major insurers use some form of automated prior authorization. These algorithms are trained to flag, reject, and delay. In fact, some tools use predictive modeling to estimate how likely you are to fight back. If you live in a low-income zip code or have no legal support, it's a denial machine. And it's working better than ever. And what happens if you try to fight back? Insurers have deep legal teams and layers of bureaucracy. Most people give up, beaten not by the facts, but by fatigue and lack of funds. And when cases go to court, they often settle quietly with non-disclosure agreements, keeping the truth hidden from the public. Meanwhile, AI tools like NaviHealth's NH-Predict are embedded in Medicare Advantage programs supposedly designed to protect seniors, but in reality, they're weaponized to cut costs at the expense of dignity and life. One former case manager blew the whistle on a major insurer. She was instructed to override doctors' recommendations using an algorithm's decision, even if it contradicted medical judgment. Her testimony revealed what many insiders already knew. In this system, profit has more authority than your physician. But here's where the mask really comes off. Insurance companies love to say they exist to keep people healthy, to protect families, to make care more affordable. But behind the slogans, billions in profits. Stock prices that soar when payouts drop. and executives earning tens of millions while patients fight for their lives. Cigna CEO David Cordani took home $20 million in 2022. That same year, his company denied hundreds of thousands of claims in seconds flat. UnitedHealth, the largest U.S. insurer, reported $22 billion in profit in 2023, and they were caught using AI to deny elderly patients long-term care coverage. And if you think they don't know the impact, think again. Internal documents from multiple insurers have shown explicit awareness that AI tools reduce costs by increasing denials. One document even flagged that the tools might cause harm, but executives pushed forward anyway. Because what's a few lives lost compared to a better quarter for shareholders? And while families mourn, while patients are buried, those same executives celebrate record-breaking earnings on yachts, in boardrooms, and behind closed doors. The system isn't just broken, it's built this way. Built to profit off delay, off doubt, off suffering. And here's the twist. Most of the people getting hurt, they're the most vulnerable. Low-income patients, elderly patients, non-native English speakers, people with chronic conditions who need care just to survive. If you're poor or marginalized, the machine sees you as an easy target. Less likely to fight back, less likely to go public, less likely to sue. It's not just discrimination, it's design. Let's look at rural hospitals, many of which have closed because insurers delayed or denied reimbursements. Patients in those areas now travel hours for care. In a healthcare emergency, that delay is often the difference between life and death. Meanwhile, states with the highest claim denial rates also rank among the lowest for health outcomes. In Mississippi, for example, denial rates top 40% for some services, and Black patients are twice as likely to be denied advanced imaging as white patients, even with the same symptoms. This isn't accidental. This is structural violence with an algorithm holding the knife. If this kind of story makes your blood boil, consider subscribing to Rise, Rule, Ruin. We tell the stories the mainstream media won't and expose the power plays hiding behind everyday systems. And if you've ever had a medical claim denied, tell us in the comments. You are not alone. So let me ask you again, is AI already killing us? Because when a machine can deny your medical care faster than a human can blink, and people are dying while waiting, that's not just tech. That's not innovation. That's execution by algorithm. This is about real lives, real pain, and a system that rewards denial more than healing. So what part of this story hits you the hardest? Drop your thoughts in the comments below. Share your story and share this video, because the more people know what's happening, the harder it becomes to ignore. This is Rise, Rule, Ruin, where we don't just tell stories about power and corruption, we expose it.